So now this is another case, and this is a Ringbone case, and this was one of the first horses we started. He was 17, dressage schoolmaster, and those horses are honestly worth their weight in gold because usually they're paired with an amateur who's trying to learn the upper levels, and these horses have been at the upper levels and are kind of coming down from it. And a common problem in them is, because they're large, is ringbone or arthritis of the upper pastern joint. So in this case, it had had some injections, wasn't terribly successful, didn't keep it sound for very long, and once we radiographed it and said, well, it is ringbone, then we started shockwaving it. And this horse, we shockwave every 4 to 6 months with a combination of the 5mm and 20mm probes, 2,000 pulses, and this horse continued to show at lower levels and was maintained for 3 years. Actually, the horse is now 23, I believe, is retired from competition, but the owner still brings it in at 6-month intervals for shockwave because she just notices how much more comfortable the horse is out in the pasture. So it's been a real quality of life issue for this horse. And this horse actually taught us quite a little bit about how successful you can be managing ringbone, because it used to be, we said you can inject it, you can change shoeing, you can use non-steroidals. They're going lame in a year or two, they're not going to be useful to you. And this was a horse that we were able to stretch out its career for some time, so it's very successful. Here you can see the placement of the probe on the arthritic area. Very straightforward, non-invasive, no needles, no repeated cortisone treatment, so very effective treatment.